Okay, just keep that thought in mind too, because we're going to see them. They're right here. This is going to be the humeral circumflex. All right, so here we are. Here's the clavicle. Here's the clavicle. So on this model, if we were to just kind of go straight across, and you're going to argue, oh, the label was over there, it was over there. This is what's left of the subclavian, all right? Because that's approximately equal with the clavicle. All right? You see it better here. All right? Oh no. On that one. See it on the other guy. I know you're trying to videotape. Right on here, okay, you have the brachiocephalic trunk. You guys can see it. Brachiocephalic trunk. And then right about right here, I'll put my fingers on it. Here and here. Right there and here. That's where you see the subclavian going into the arm. This may be not, we'll see which model has it best, but here's the carotid going up and subclavian going into the arm. And that's leading into this. That's the bit of it right there. When it hits the clavicle, so from here to about right here, that's the axillary. And then you'll see that at this point, when you look closely, it's going to branch into the brachial. Right, here's the brachial coming right down here. And the little branch going in is the deep brachial. Right, it's just to really see just a little bit of it branching off of there. You possibly, well, I was going to say, you possibly see some of it piercing through the back over here too, okay, as it pierces through. Just a little bit of it like that, and then there's some collateral branches coming on. This is where you take the brachial pulse. You can feel a pulse point here. You use this brachial pulse when you're doing blood pressure. That's where that artery is. And then that's going to branch and give us some of the arteries of the forearm, radius, radial ulna, interosseous. But I just want to point out two other things here. When, again, you got to look closely at the model, it's behind this thing, right? It's behind this thing. So when you look behind it, you'll see the branch for the deep brachial down here, but you also see a branch piercing through coming here, and that's the humeral circumflex. Most likely the one that you see here is the posterior humeral circumflex because it's coming around the back of the humerus. There's also one that wraps around the front. You see this circumflex. And it's taking care of the bone and some of the muscle tissue in this area. You get down here, on your way down, you had your deep brachial penetrating and going behind into the triceps area. You have your brachial coming down the front, and that's it there. When you get to about here, there's another little branch that comes off. And it seems to be kind of running down the side here, coming down into the side of the arm. You can see it, the last one on the left, ulnar collateral artery. And it's pointing to like a vessel that's running along the inside of the arm. Right there, so one of your ulnar collaterals coming off of the brachial. Collateral artery means they're like kind of an additional artery, an artery in addition to the main. The ulnar collateral is in addition to the ulna, which is down here. Right. So we have a bit of the subclavian, axillary, brachial. We have branches off of the brachial, posterior humeral circumflex. We have put my finger on it, somewhere right about here, the deep brachial going to the back of the arm. And right about here, an ulnar collateral. Then we get to the elbow, and they're going to branch, and it's pretty clear to see that there's kind of three branches. One running along the side of the thumb, two running along the side of the pinky, and one right down the center. Right? This is the radial, running along the radius, the ulna, running along the ulna, and the interosseous in between the bone. You can kind of see that as they run down, they form the arch, right? A palmar arch. Okay, this would be possibly the anterior palmar arch. And you can see the digitals coming off, going up to the fingers. I know you could make believe that there's also the formation of, looks like a posterior arch here with the digitals coming off of that. Doesn't completely go all the way around. I guess maybe, you know, it's almost missing just one little bit of red there to make the complete arch, but the palmar arches. So that's pretty easy. The radial bone, the radial artery, ulnar bone, ulnar artery, in between the interosseous, ulnar arch, digitals. And all of those, subclavian, axillary, brachial, ulnar collaterals, two of them on there, circumflex, radius, ulnar, and interosseous arch and digitals, the same exact ones are on that flat board, just in a flat plane, easy to see. The deep brachial, you can see, you know, one of those branches is the deep brachial. Exactly which one, who knows? See all, that's the brachial. See those little branches coming off of the top branch? Those are the two. That's anterior, posterior, circumflex. And then going down a little further, probably the deep brachial, one of those. They're not that clearly labeled. Okay, but those are the main ones of the arm. So hopefully you made notation of that. And here's what I was talking about. It branched into the radial, the ulna, and the interosseous.